I am Ramaswamy Govindan, a medical oncologist, a professor of medicine at Washington University in St. Louis. How do we sequence chemotherapy with radiation, and what should patients expect during this combination of chemotherapy and radiation treatment programs? In general, the commonly accepted treatment program today, at least in the US, is the weekly administration of chemotherapy. We administer a combination of two drugs, paclitaxel, commonly known as Taxol, or carboplatin, and we combine these two drugs on a weekly basis, and we give this along with radiation therapy. Radiation therapy to the chest in the setting of stage 3 or locally advanced lung cancer is given often over 5 to 6 weeks. And during those 6 weeks time or 5 weeks time, chemotherapy is administered once a week as an infusion and with a combination of these two drugs. The idea is to enhance cancer cell killing by combining both chemotherapy and radiation, almost like 1 + 1 becomes 3, and that's the idea. We have done several clinical trials over the past 20 years to really clarify how best to do these chemotherapy radiation treatment programs. And in general, we give a combination of these two drugs on a weekly basis with radiation. That turns out to be a better strategy than other approaches. Like, for example, giving chemotherapy first and then radiation, or radiation first and then chemotherapy later. So ideally, they have to be done together, and that's the way it is given. There are also other regimens where chemotherapy is given once every 3 weeks, while radiation continues to go on a daily basis for 5 to 6 weeks. And so it is, they're about the same, and there is a lot more experience with the weekly chemotherapy regimen. That's what I use very often, and that's what likely most patients in the US are getting today. And again, you should talk to your doctor about this, and then really understand how this schedule is going to be planned. In terms of side effects, again, the infusion itself is fairly well tolerated. These days, we have very good medicines to control nausea and vomiting, so the infusion itself goes relatively smoothly. Occasionally, the paclitaxel chemotherapy can cause some allergic reactions. To prevent that, we ask patients to take dexamethasone, that is steroids, the day before or in the morning of chemotherapy. Again, you should consult with your physician. Your team will give specific instructions on the pre-medications, and that varies a little bit from practice to practice. But in general, with the steroid pre-medications, it almost completely, the side effects, especially allergic reactions, are eliminated. And in some practices, the steroids are given intravenously right before chemotherapy. That works as well. And so there are some various different ways to mitigate the allergic reactions from the Taxol chemotherapy. But in general, the patients who get chemotherapy and radiations have some fatigue. It is expected that chemotherapy can cause fatigue, radiation can cause fatigue. So together, not surprisingly, they cause some fatigue. And in the past, you would see a lot of complaints about difficulty in swallowing because the radiation goes to the right to the center of your chest, and esophagus is right in the middle, and you'll have some inflammation caused by radiation, and chemotherapy makes it slightly worse. But these days, the radiation therapy planning has become so precise and so targeted to chemotherapy, the tumor, where the tumor is, that I don't see significant or serious side effects with difficulties in swallowing as much as we used to see before. And but again, if that happens, there are various different ways we can treat. It's a transient problem, and we can manage that. And then the chemotherapy and radiation both can decrease the blood count. So we expect the blood counts to go down a little bit. And but for most part, it doesn't really translate into anything major except blood test changes we observe. And Again, there are lots of different rare side effects that can happen. The chemotherapy can cause some numbness and tingling, but typically over a 6-week period, we give a fairly modest doses of chemotherapy. So I don't see that to be a major problem. And again, a few months after the completion of chemotherapy and radiation, you can have some lung inflammation from the delayed effects of chemotherapy and radiation. So if that happens again, there are various effective ways of managing that. It's not a major problem. We can handle for most part. And these days, after chemotherapy and radiations, radiation treatment, people get immunotherapy for a year. And that's something your physician will talk to you about. But during chemotherapy and radiation, most patients can expect to have some difficulty in swallowing, but not much, and fatigue, and some drop in the blood counts. Again, it's important as physicians, we should point out that the side effects vary quite a bit between patients. For some, the fatigue may be a major problem, or some difficulty in swallowing may be a major problem. But the key message is that most of them are transient, all of them are transient, and most of them are fairly mild to moderate, and we can manage that with effective symptom control.